Let's talk about the pharmacology topic right now, sir. We all are ready for the pharmacology. Pharmacokinetics and pharmacodynamic. What a body do to a drug is called as kinetic, और drug क्या करता है body से, that is dynamic. तो kinetic is ADME. What is this ADME, sir? ADME is A for absorption, distribution, metabolism and excretion. तो पहले absorption हुआ from the site of administration to the blood. कहाँ से भी एडमिनिस्ट्रेशन, आईवी रूट से दे दिया आपने, ओरल रूट से दे दिया, रेक्टल दे दिया, ठीक है. नाउ सर डिस्ट्रीब्यूशन, अमाउंट ऑफ ड्रग गोइंग टू द टिश्यू, टिश्यू के पास कितना पहुंचा, मेटाबॉलिज्म कितना उसको वाटर सॉल्युबल बनाया ताकि वो किडनी से बाहर आ सके, दैट इज कॉल्ड एज एक्सक्रीशन. सो वन बाय वन वी आर गोइंग टू फोकस ऑन ईच स्टेप, सर, इंपॉर्टेंट फॉर द एग्जाम. नंबर वन इज एब्जॉर्प्शन. द मूवमेंट ऑफ ड्रग फ्रॉम साइट ऑफ एडमिनिस्ट्रेशन टू द ब्लड. एब्जॉर्प्शन डिपेंड ऑन द लिपिड solubility. More lipid solubility, more absorption will be there. Then the next concept is of a bioavailability. What is bioavailability, sir? A percentage of given dose which reaches the systemic circulation is a bioavailability. Okay. Now bioavailability is inversely proportional to first pass metabolism. यानी कि अगर फर्स्ट पास मेटाबॉलिज्म, लीवर के पास पहले ड्रग नहीं जा रहा है तो 100% अवेलेबल होगा. तो विच रूट इज हैविंग 100% बायोअवेलेबिलिटी? कैन यू टेल मी which route is having 100% bioavailability? Your answer is IV route is having 100% bioavailability. ये हो गया आपका previous year का question. Now distribution. Now amount of drug going to the tissue. Now volume of distribution is amount given IV upon plasma concentration of the drug. It is amount of drug given IV upon plasma. These are the formulas you have to remember for the exam. Write it somewhere, have a pad, keep writing along with me also. ठीक है. Now, volume of distribution is equal to plasma, amount of drug given IV upon plasma concentration of the drug. Now, loading dose का formula is volume of distribution multiplied by target plasma concentration. So, volume of distribution was amount of drug given IV upon plasma concentration. Loading dose depend करता है volume of distribution multiplied by target plasma concentration. Now, maintenance dose depends on clearance into target plasma concentration. And here the volume of distribution is inversely proportional to plasma protein binding. जितनी plasma protein के साथ bind होगा drug, उतना कम distribute हो पाएगा. This is what it is saying. I hope it is clear to all of you. Now, this metabolism part. Let's talk about this. Metabolism part, make the drug water soluble. तो कैसे ड्रग को वाटर सॉल्युबल बनाया जाता है? पहले इसको तोड़ा जाता है, फिर इसको जोड़ा जाता है. तोड़ा इज फेज 1, जोड़ना इज फेज 2. तो तोड़ने वाले में क्या क्या प्रोसेस हो रहे हैं? हाइड्रोकॉर्ड, दैट इज हाइड्रोलिसिस, साइक्लाइजेशन, ऑक्सीडेशन, रिडक्शन एंड डिसाइक्लाइजेशन. सिंपल वर्ड्स है. देन फेज 2 इज कॉन्जुगेशन, जिसमें जोड़ा जा रहा है, जिस GGAM, ग्लूकुरोनाइड, ग्लूटाथाइन, एसीटाइलिन, मीथाइल. ये जोड़ने का काम कर रहे हैं ये प्रोसेस के थ्रू में ये टूट रहा है. नाउ एंजाइम इंड्यूसर कौन है, इनहिबिटर कौन है? GPCRS सेल फोन आर द एंजाइम इंड्यूसर. व्हाट आर दे? ग्रेसियोफ्लोविन, फेनिटोइन, रिफाम्पिसिन, स्मोकिंग, कार्बामाज़ेपिन एंड फिनोबार्बिटोल. ना एंजाइम इनहिबिटिंग कौन है? विटामिन K कांट कॉज एंजाइम इनहिबिशन. तो वैल्पुरेट, कीटाकोनाजोल, सिमेंटिटिन, सिप्रो, एरिथ्रो एंड आइसोनाइजेट. जस्ट विद द हेल्प ऑफ न्यूमोनिक you have to remember later on also. Excretion is water soluble drugs coming out and lipid solubles are reabsorbed. So if the drug is lipid soluble, it will go back. If it is water soluble, it will be excreted, sir. Now coming on to the first order kinetic and zero, how they are secreted. The first order and zero order kinetic is also your previous year ka question, sir. How they are going to come in your exam. First order is a constant fraction you are talking about. You are talking about the constant fraction. Zero order, constant amount is removed. The percentage may remove हुआ. Let's suppose 100 mg drug was there, 50%. Then it become 50, then 50%, 25, 12.5, 6. Like this, it will go outside the body in the percentage form. Then remember, this is going to be the first order kinetics. If constant amount is going 10 ml, 10 ml, 10 ml, 10 ml, 20 ml, 20, 20, 30, 30, 30, this is going to be the zero order kinetics. Fixed amount, zero order, fixed percentage, first order. This is how you will differentiate. And what are the drugs which are following the zero order kinetic, that is 0 watt power? What are those drugs, my dear friends? Warfarin, alcohol, theophylline, tolbutamide and phenytoin. So 0 watt power bulb is the answer to the question, sir. Now, sir, enzyme inhibition, competitive and non-competitive. Now we are talking about the drug do to a body. What drug is going to do the body? So Km is taken, K max is taken as a kilometer. Vmax is taken as a speed, sir. If there is a competition, kilometer will increase, speed will be constant. If there is no competition, same kilometer and speed will be decreased. This is how beautifully we remember this thing for exam. Okay, real concept is something else behind that, but if you remember this much, you will be able to solve the question. So enzyme inhibition in a competitive phase and non-competitive. Competition में किलोमीटर रहेंगे बढ़ जाएंगे और स्पीड रहेगी सेम. नॉन कॉम्पिटिशन में किलोमीटर सेम रह जाएंगे, स्पीड हो जाएगी कम. Now coming to the affinity, intrinsic activity. What is this affinity? Ability of a drug to bind to a receptor. Ability of a drug to bind to a receptor is called as affinity, and how much action they can produce after getting binding to the receptor, that is called as intrinsic activity, sir. On the basis of intrinsic activity, we have agonist and antagonist, sir. Antagonist, agonist, reverse antagonist, those are the types of things we are having. Now this is something important, dose response curve, my dear friends. In the dose response curve, my dear friends, we are having potency and efficacy. Potency is the left sidedness, जितना left होगा उतनी potency बताएगा. Efficacy is fly, जितनी height होगी उसकी वो efficacy होगी. If we see this graph right here, sir, you will see more left is A, then B, then C. The potency is A, B, C, A more than B, then C. Efficacy is height, so C is higher than A, then B. So C, A, B you have to do, right? So now drugs that are metabolized by acetylation, those are the SHIP drugs, my dear friends. The SHIP drugs are sulfonamide, hydrolyzed isoniazid. Their adverse effect is SLE. Again, important question for the exam. Now coming to the clinical trials, clinical trial. Phase 1, phase 2, phase 3, phase 4. Now these are some important questions for the exam. Phase 1, my dear friends, what happened? It is done in the healthy population to know the max tolerance of the drug. The phase 1 is the only phase which is done in the healthy population. First important question. Second important question is what, sir? Phase 2, it is done in approximately 200 to 20 patients. It will check the efficacy and safety of the drug. Phase 3 is done in approximately 5,000 patients, where the new drug is compared with the old drug. This is called as standard drug control. This is called as standard drug control, my dear friends. And phase 4, after phase 3, the drug is coming in phase 4, that is called as post-marketing trial. It is done for the rare and long-term side effects. अब ये बिकना शुरू हो गया है. आप लोग इसको यूज करने के बाद बताएंगे कोई रेयर साइड इफेक्ट तो नहीं आ रहा. दैट फीडबैक वी हैव टू गिव इट बैक. सो दीज आर द 4 इंपॉर्टेंट क्लिनिकल ट्रायल. एंड जीरो ट्रायल इज और फेज 0 इज आल्सो देयर. माइक्रो टेस्टिंग विच इज डन इन द लैबोरेटरी इटसेल्फ. बट रिमेंबर माय डियर फ्रेंड्स, दीज आर फेज 1. फेज 1 is healthy, 2, 3, 4 in the patient. 4 is a post-marketing trial, which is a pre-marketing trial, that is 3, where standard drug control is done, where the old drug is compared with the new drug, where efficacy and safety is checked. Efficacy safety check in both phase 2 and phase 3. Along with the standard drug control, we just check the efficacy plus safety in this phase. Done, sir. Now drug safety. How you check a drug safety, my dear friends? Therapeutic index is telling you about whether the drug is safe or unsafe. What do you mean by safe or unsafe drug? Sir, if your drug is unsafe, on increasing a little dose, which is an effective dose, it will become a lethal dose. And if the drug is safe, for example, paracetamol is a safe drug, their therapeutic index is very broad. You can increase the dose, but not that much side effect you are going to see. But the drugs like 𝗖𝗵𝗵𝗵𝗺, aspirin, these drugs, if you will slightly increase the dose, you will see it will become lethal now. It will become lethal now. Now, sir, therapeutic index is calculated lethal dose upon effective dose. Narrow therapeutic index, unsafe drug. Unsafe drug के अंदर we require a therapeutic drug monitoring. Broad therapeutic index is a safe drug. For example, paracetamol is safest drug, I have told you. Now coming to the autonomic nervous system, which is divided into 2, parasympathetic and sympathetic. Very important to know this topic. Now what is parasympathetic? First of all, I'll tell you, then I'll draw some diagram and tell you. Major neurotransmitter is acetylcholine and sympathetic is noradrenaline. Okay, done. Now parasympathetic and sympathetic, if you see, get an empty space or no. Chalo, let's draw it here only. Chalo. So let's see parasympathetic and sympathetic. What is happening in the parasympathetic, sympathetic? This is parasympathetic person. In the parasympathetic, what will happen? Abdomen and below abdomen, everything increase. Above abdomen, everything decrease. For example, if you see eyes, there will be meiosis, bronchoconstriction, heart rate, cardiac output will decrease. And GIT functions, which is below, it will increase diarrhea, erection will happen, and secretions will increase. This is what it will happen in the parasympathetic. Now, opposite will happen in the sympathetic. Above the abdomen, everything will increase, and below the abdomen, everything will decrease. Now, above abdomen, if everything increases, my dear friends, so eyes में mydriasis, bronchus में bronchodilation, heart में cardiac output, BP, heart rate will increase. And GIT, which is decreasing, there will be constipation, flow will come, ejaculation, secretions will also decrease. Now, what are the receptors of the parasympathetic and what are the receptors of the sympathetic? M1, M2, M3, M4, M5, they are the receptors of M type of receptor. They are for the parasympathetic. Alpha, beta, they are for the sympathetic. They are for the sympathetic. So let's talk about first cholinergic drug. Cholinergic drug, that means parasympathetic drugs we are talking about. Parasympathetic, number one is pilocarpine. Pilocarpine is a treatment of choice for angle closure glaucoma, and they are acting by M3. M3 is present almost everywhere. All places it will be present. If it is acting above the abdomen, what it will do in the parasympathetic? It will do the meiosis. So in the pilocarpine will do the meiosis and it will treat the angle closure glaucoma. Methacholine, it act on the myocardium. So what it is doing? Decrease the heart rate. Now indirectly acting, their mechanism of action is acetylcholine esterase inhibitors. Now lipid soluble like 𝗖𝗵𝗶, my dear friends, the drug of choice for atropine poisoning, another MCQ. Water soluble like neostigmine, pyridostigmine, they are good for the treatment of myasthenia gravis. Androphonium is going for the tensilon test, which we do in the case of a myasthenia gravis. Now coming on to the next important, atropine, datura, belladonna poisoning, drug of choice is 𝗖𝗵𝗶. Organophosphate and carbamate and early mushroom poisoning, drug of choice is atropine. And organophosphate alone poisoning, drug of choice is atropine plus oxim. Both are very, very important. These three are very important. Now anticholinergic drug, like anti-parasympathetic, उल्टा कर रहे हैं तो sympathetic जैसा act करेगा. Anticholinergic drug according to the effect. Stomach पे we are having M1 blocker. M1 normally present in the stomach. In the parasympathetic, it increases the HCl secretion. But here we are blocking this. That is anticholinergic. The M1 will be blocked. That means there will be no secretion of HCl. So M1 blocker is used for treatment of peptic ulcer. That is pirinzapine and telenzapine, previous year question. Heart में M2. M2 normally in the heart, what will do? Decrease heart rate. But here atropine acting through the M2 channels will block it and it will increase heart rate. So atropine is a drug of choice for AV block bradycardia. AV block bradycardia, it will increase the heart rate now, atropine. Now bronchus, normally bronchus, what it is doing? Bronchoconstriction. But if I block M3 blockers, which is present in the bronchus, the drugs which are acting through that, ipratropium or tiotropium, they are used in the treatment of bronchial asthma or COPD. They will dilate it. They will what, sir, do? Dilate it. Then coming to the bladder. Normally in the parasympathetic, what your bladder is doing? Bladder activity is increased. If I block it, bladder activities will be decreased. So we can treat the overactive bladder. So drug like solifenacin, darafenacin, oxybutynin will help us in treating the overactive bladder. Now eyes के अंदर M3 blocker like atropine is a drug. These are anti-mydriasis, cycloplegic. Action is mydriasis and they are cycloplegic drugs. So atropine is used in the children for the mydriasis. Why? Because of the strong ciliary muscles. So atropine is used in the children and tropicamide is used in the adult. What is their effect? Their effect is M3 blockers. They are what, sir? Your M3 blocker. They are what, sir? M3 blocker. So these are the important drugs you need to remember in case of a parasympathetic system. One is agonist, antagonist. Now coming to the sympathetic. Now sympathetic nervous system works with the phenomena of alpha and beta receptors. If I say alpha 1, alpha 2, beta 1, beta 2 in the beginning, just this thing in the beginning I want to tell you. Sir, alpha 1 and beta 1 act similarly. They both are doing vasoconstriction. Where? We'll talk it out. And opposite is done by alpha 2 and beta 2. Alpha 1 का उल्टा alpha 2 करता है, beta 1 का उल्टा beta 2 करता है. Let's see where they are present, how they will be doing ulta. Now we are talking parasympathetic. That means above abdomen everything will increase and below abdomen everything will be decreased. And if sympathetic mimickers we are giving, they will increase above the abdomen. If anti-sympathetic drugs we are giving, they will decrease above the abdomen and increase below the abdomen, my dear friends. Now coming on to the alpha-1. Alpha-1 are mainly present at blood vessels. So they do vasoconstriction at blood vessels. Alpha-1 are present at eyes. So eyes में पेट के ऊपर सारी चीजें बढ़ाता है sympathetic. They will do the mydriasis. Now below abdomen, your sympathetic system decreases. So below unit, below that, if alpha is working, तो remember flow को कम करेगा. ठीक है. On alpha-2 acts as a brake on alpha-1. This much you understood. Now beta-1, which is present at heart, it will do vasoconstriction on the heart. Kidney में क्या करेगा? Secrete renin करेगा. Beta-2, which is present on the bronchus, it will do the bronchodilation. Bronchodilation lungs पे. GIT के functions को क्या करेगा? If it is sympathetic system, GIT के function को कम कर देगा. Bladder को कम करेगा. GIT को कम करेगा function को. Blood vessels के अंदर ये क्या करेगा? Dilation करेगा. Beta-3 urinary bladder के function को कम कर देगा, because sympathetic below abdomen everything decreases. So this is a basic fundamental behind the alpha beta receptors. Now according to the different drugs where they act, let's learn this thing. First adrenergic drug is dopamine. It is stimulated by alpha-1, beta-1 and D1. And now where D1 is, they are present in the kidney. How they are helpful? Alpha-1 कहाँ है, beta-1 कहाँ है? Alpha-1 blood vessels में है, beta-1 आपका heart के ऊपर है और D1 आपका kidney पे ऊपर है. How it is going to help us in shock with oliguria? ना shock हो गया, पेशाब नहीं आ रहा, so dopamine दे रहे हैं. Alpha-1 will do vasoconstriction, which is a treatment of shock. Shock में vasodilation हो रखी है, vasoconstriction कर दी alpha ने. So D1 is present in the kidney, it will do the vasodilation of the kidney and that will treat the oliguria. So dopamine is a drug of choice for shock with oliguria. Dopamine is a drug of choice for shock with oliguria. Now noradrenaline is only used in the shock, but if shock with renal failure is there, oliguria is there, then dopamine is drug of choice. Why? Alpha, beta and D1 are there. ADR, drug of choice for anaphylactic shock, cardiac arrest. Now two compositions you have to remember. Anaphylactic shock के अंदर firstly we'll try to give the IM route where concentration is less as compared to the IV route. So in the IM route the concentration is 1:1000. In the IV route the concentration is 1:10,000 in the anaphylactic shock. But if it is cardiac arrest, we will directly go with the IV route and the concentration is 1:10,000. Now anti-adrenergic, now opposite actions they will produce. Anti-adrenergic drug. So remember, non-selective alpha blockers like phenoxybenzamine, drug of choice for pheochromocytoma. Phentolamine, drug of choice for cheese reaction. One-liners you have to remember. Selective alpha-1 blocker. Selectively alpha-1 is blocked. Now alpha-1 function was what? Alpha-1 was doing the vasoconstriction. Now it is blocked, it will do the vasodilation. Okay. Now the drugs like perazocin, terazosin, doxazocin, doctor. Remember, they are drug of choice for BPH with hypertension. They are drug of choice for BPH with hypertension. And side effect is postural hypotension. Side effect क्या इनका? Postural hypotension, because lot of correction can also lead to hypotension. Now selective alpha-1A blocker. This is selective alpha blocker. Alpha-1 blocker. This is alpha-1A blocker. Alpha-1A blocker. Better than alpha-1. Why? Because it will not do the postural hypotension. Like tamsulosin, silodosin, they are drug of choice for BPH. Para doctor, yes. BPH. Selective beta-1 blocker like nebivolol, nadolol, long-acting beta blocker. They are the long-acting beta blocker. Now sir, let's talk about the hematology now. The drug affecting the blood flow like thromboxane A2. Thromboxane A2 and answer. What thromboxane A2 was doing? Vasoconstriction. Platelet का aggregation कराता है. तो अगर blood आपका तो thromboxane A2 inhibitor कौन है हमारा? Aspirin. Aspirin क्या कराता है? Aspirin will do vasodilation which will decrease the platelet aggregation. Blood thinner की तरह use करते हैं सर. Now adenosine diphosphate inhibitor like clopidogrel. So thromboxane A2 inhibitor, ADP inhibitor, these drugs are what sir? Affecting the blood flow. They are doing the blood thinning so that more blood can reach. Now antifibrin, anticoagulant like vitamin K and your unfractionated heparin. This is something which is important for your exam. Why this is important? Multiple time questions are asked. Now vitamin K antagonist कौन है? Warfarin. Vitamin K का उल्टा कौन है? Warfarin. Monitoring कैसे करोगे warfarin toxicity? PTINR. Contraindicated. War is contraindicated in pregnancy. Treatment of warfarin toxicity. What you will give? Vitamin K if bleeding is not there, but if active bleeding is present, first you will give the fresh frozen plasma and then you will give what, sir? Your vitamin K. Then you will give the vitamin K, sir. Okay? Now, indirect factor 2A inhibitor are unfractionated heparin, low molecular weight heparin. This is an anticoagulant of choice in the pregnancy. How you will monitor is APTT. PTNR is monitoring of warfarin. Treatment of warfarin is your vitamin K itself. And here unfractionated and low molecular weight heparin. The monitoring is done with the help of APTT, and the drug of choice antidote for the heparin toxicity is your protamine sulfate. Again, a previous year question which has been asked in the exam. Sir. Now coming to the drug affecting the cells of the blood. Cells, as we already talked about the RBC. RBC, R for R, that is darbepoetin, epoetin. Darbepoetin, epoetin. Darbepoetin, epoetin. Then coming to the WBC. WBC को filgrastim, stagramustin, platelet बढ़ाने का operliquin and ultramobopeg are the drugs which are given. This is again a previous year question of your exam. My dear friends. Coming on to the next GIT के drugs again, sir. M1 blocker, pirenzapine, tilenzapine, H2 blocker, cimetidine, rentidine, proton pump inhibitors like pantoprazole, lansoprazole, omeprazole, rabeprazole and esomeprazole. Drug of choice for peptic ulcer, GERD, gastroesophageal reflux disease, 𝗲𝗲𝗴𝗿𝗺 syndrome, in which HCl secretion is increased plus patient will be having a diarrhea. ऊपर gas बन रही है, नीचे diarrhea. This is 𝗲𝗲𝗴𝗿𝗺 syndrome. So these kind of diseases are we having a drug of choice. This is also proton pump inhibitor. Anti-H. pylori drugs, sir. Triple therapy we give, sir. 2 antimicrobial with 1 PPI we give. Sir, remember scap mnemonic for this. Clarithromycin and amoxicillin are the 2 antimicrobial and 1 PPI we can write. Anti-emetic drugs, sir. Anti-emetic drugs, sir. Drug of choice for motion sickness is hyoscine. Morning sickness is doxylamine, जो pregnancy के initial phases में होता है. Mountain sickness is going to be your acetazolamide. Motion sickness drug of choice is going to be, it is hyoscine. Morning sickness is going to be hyoscine, which is Buscopan के नाम से बड़ा famous है. Mountain sickness is going to be the drug of choice for carbonic anhydrase inhibitor drug होता है. Which drug is there going to be the mountain sickness, my dear friends? The mountain sickness drug of choice is going to be the acetazolamide. Acetazolamide. And if chemotherapy induced vomiting, we are going to the ondansetron, which is 5-HT3 serotonin inhibitors. 5-HT3 inhibitors. Now coming to inflammatory bowel disease like ulcerative colitis and Crohn's disease. What are they exactly? We are going to talk in the surgery class. Sir, ulcerative colitis, we are going to this 𝗲𝗲𝗴𝗿𝗺, 𝗲𝗲𝗴𝗺. And Crohn's disease drug of choice is steroid. If the patient is resistant to steroid, then we give our monoclonal antibodies like, TNF alpha inhibitors like certolizumab, adalimumab, golimumab and entanercept. Certolizumab, adalimumab, golimumab and entanercept. These are the TNF alpha inhibitor. They are contraindicated in TB and hepatitis B. BB. TNF alpha are contraindicated in BB, that is TB and hepatitis B. TB and hepatitis B. Coming on to the next one is CNS drugs. CNS drugs, sir. Sir, CNS drug, anti-epileptic drug. Anti-epileptic drug, what are they? Now, what is happening in the seizure or any brain activity? It increases. Now, anti-epileptic drugs are the people who will decrease the brain activity. This is how we are going to get the relief. So, my dear friend, mechanism of action. Mechanism of action of anti-epileptic drug is to increase the inhibitory neurotransmitter and to decrease the excitatory neurotransmitter. How we can give, sir? We can increase the GABA and we can decrease the glutamate. Plus we can block the calcium-sodium channel. Calcium and sodium channel को block कर दो. Glutamate जो excitation करा रहा था उसको कम कर दो. और GABA जो inhibitory था उसको बढ़ा दो. GABA जो inhibitory था उसको बढ़ा दो. Now, sir, drug that release GABA are GABA, praga. दो ड्रग ऐसे देने हैं जो गाबा रिलीज करते हो, क्योंकि गाबा ऑलरेडी इनहिबिटरी न्यूरोट्रांसमीटर है, सो गाबापेंटिन प्रेगाबैलिन। नाउ ड्रग दैट इनहिबिट द रीअपटेक ऑफ गाबा, गाबा को वापस जाने से रोकता है, वही रखता है, कर तू काम और मेहनत कर, क्योंकि मेहनत करने वालों की, कोशिश करने वालों की कभी हार नहीं होती। तो कौन सा है वो? टियागाबिन, टियागाबिन, लाइक टिया भाभी, टिया भाभी गाबा को वापस नहीं जाने दी, अरे मेरे गाबा वही काम कर प्यारे। नाउ ड्रग दैट एक्ट्स ऑन ए गाबा रिसेप्टर, जो गाबा के रिसेप्टर पे जाके काम करते हैं और काम कराएंगे, बारबिचुरेट लाइक फिनोबार्बिटोन, बेंजोडाइजापीन लाइक डाइजेपाम, एल्प्राजोलैम, लोराज़ेपिम, ये दिमाग को सुलाने का काम करते हैं। क्या करते हैं सर? ये सुलाने का काम। एंटीडोट ऑफ बेंजोडाइजेपीन अगर टॉक्सिसिटी हो जाए, फ्लूमाजानिल विच इज ऑल्सो अ रिवर्सल एजेंट ऑफ चॉइस, वी आर गोइंग टू टॉक इन द एनेस्थीसिया पार्ट सर। Now drug of action, now drug that increase the action of glutamate, decrease the action of glutamate, glutamate के action को कम करना है, because this is excitatory neurotransmitter sir, AMPA inhibitor and NMDA inhibitor, so these are Pramapel and Phlebamate, Pramapel and Phlebamate are the drugs. Now calcium channel blockers like 𝗏𝗏𝗏 are drug of choice in absence seizure less than 2 years, less than 2 years, ठीक है चलो। Now sodium channel blocker like phenytoin, carbamazepine, so sodium channel भी ब्लॉक कर दिए, कैल्शियम चैनल भी ब्लॉक कर दिए, ठीक है, आपने ग्लूटामेट के एक्शन को कम कर दिया, गाबा के रिसेप्टर को बढ़ा दिया, फिर गाबा को वापस जाने से रोका, सो दीज आर द एंटी-एपिलेप्टिक ड्रग्स। नाउ वैल्प्रोएट इंपॉर्टेंट, ड्रग ऑफ चॉइस फॉर GTCS जैसे जनरलाइज्ड टॉनिक क्लॉनिक सीजर, absence season more than 2 years, and here 𝗏𝗏𝗏𝗏 is for less than 2 years. Myoclonic seizure, atonic seizure, side effect is hepatotoxicity, pancreatitis and PCOD, नहीं भी याद रहता है, कोई बड़ी बात नहीं है, ठीक है। Now bipolar disorder, if we talk about bipolar disorder, BPD1, BPD2, overall treatment is lithium. lithium का side effect क्या है? lithium की वजह से क्या होता है सर? lithium is the one factor which will lead to Epstein anomaly, which will lead towards Epstein anomaly. And drug of choice in pregnancy is going to be the atypical antipsychotics. Atypical like perinzapine, telanzapine, and no, not this, aripiprazole, risperidone, colanzapine, olanzapine. So these are atypical antipsychotic. Going to talk in the apna psychiatry part. Opioid antagonist, naloxone, naltrexone, important. Now sir, this naloxone is a short-acting IV. So we given in IV, drug of choice for acute condition. Naltrexone, trachea के पीछे esophagus से मुंह के रास्ते थे, long acting oral. Anti-obesity drugs. So what are the anti-obesity drugs we are having? Lost, locazerine, orlistat, sibutramide, topiramide. So these are the drugs which are anti-obesity drugs, my dear friends. Now drugs used for smoking cessation. Next type of drugs we are going to talk about, smoking cessation, varnacillin and nicotine. This is varnacillin is a drug of choice for smoking cessation. If both of them is asked and you need to choose one, your clear-cut answer is varnacillin. Anti-alcohol drug, नोटा, नहीं पिएंगे, आज के बाद नहीं पिएंगे, तो याद रखना naltrexone, ondansetron, topiramide and acamprosate. So these are the anti-alcohol drugs. Then effect of disulfiram. Erectile dysfunction we talk about. This is PDE inhibitor drugs like sildenafil and tadalafil.